vomiting. So I mentioned that the neurokinin receptor is a major receptor on the vomiting center, and I forgot to mention that the receptor that play major role on the chemoreceptor trigger is the dopamine receptor. And dopamine receptor, they have the they have a signal, is the dopamine. That's the name of the receptor. And the thing is, if you want to treatment the vomiting condition, you have to know what the cause that vomiting. For example, the one they cause from the chemical xenobiotics or the some drug that induce the vomiting, you need to know that you have to inhibit the signal from both of the chemoreceptor trigger or the vomiting center. Or the vomiting that's caused from the induction from the peripheral, like a GI irritant. So you need to know that you have to block to the receptor on the urinary tract, nucleus, or the vomiting center. Or the animal that have the motion sickness, like the seasick or the car sick, that thing, so inhibit the histamine receptor or the muscarinic receptor going to be more effective to reduce that problem. And yeah, that's only because the animal, they don't have from the cerebrum signal to the vomiting center. This is the list we found in the clinic that cause of vomiting. And as you can see, like that includes everything that can be from the xenobiotics or can be the toxin that from the body condition. For example, like the toxin from the disease, like a renal disease, the body cannot excrete the urea, and that urea going to become the toxin to the body that called that condition as a uremia, and uremia can cause the vomiting. Or the pyometra have the endotoxin or have the renal impairment, and that gonna have the endotoxin or the uremia and will cause of vomiting. And what else? Infectious cause. Infectious cause can be both of bacteria infection or the viral infection that can go to the bacteria can go to the irritant to the GI tract, or they produce the endotoxin. That endotoxin can cause to the count of the toxin that can cause the vomiting. So before you treat the vomiting, you need to know what the cause of the vomiting and treat the underlying cause first, and then you have to treat the vomiting. The first group about the vomiting is the emetic agents. Emetic agent we use once the animal they ingest suspect substance, and we thought like can be the toxin. It's not commonly used in the emergency because we prefer to use a gastric lavage, we prefer to use the emetic agent. But we can use some, like we have the limited instrument, we cannot use the gastric lavage, we can use the emetic agent to induce the vomiting the animal, and that toxin can absorb to the body. The drug or the agent that can cause the vomiting can do the two types together. First, it stimulates peripherally acting emetic agents. That can be like the high solution or the high temperature, but it's not that boiling water. It can be the warm water or the 3% hydrogen peroxide or the warm saturated salt or the sodium chloride solution, and that gonna stimulate irritant to the GI tract. And some of the textbook they said you use the salt paste on the larynx or the pharyngeal area, and they're gonna cause the vomiting stimulant to that region, and the animal can cause the vomiting. And the last agent, I put the asterisk from that because ipecac syrup, they can do both actions together. First, they can be the centrally acting or the peripherally acting. But peripherally acting, because alkaloid emitting, they have like a high saturated chemical that can cause an irritant to the GI tract. And that irritant gonna increase the serotonin level, and that can cause vomiting. But you have to be careful to use EpiCap because it's highly toxic to the animal. They can increase lung hymenation, salivation, or the bronchial secretion that can cause the pneumonia or the aspiration pneumonia follow from that. And the second thing, ipecac syrup, they can absorb to the body system. And once they absorb to the body system, they can cause the cardiotoxicity. So if you use ipecac syrup as an emetic agent, and the first dose is net effect, you can use the second dose. And once the second dose, they have no effect for the vomiting, you need to do gastric lavage right away, because to prevent the ipecac syrup is absorbed to the body system. And the second type of the emetic agent is the centrally acting agent. I'm sorry about the picture. I did this like a long time ago. I didn't plan for this week. I'm so sorry. It's not intend to do that. It's the wrong time. You see my email, I sent it to Dr. Watu like very, very long time. Not, yeah. Okay, for the centrally acting emetic agent, as I mentioned, ipecac syrup, they can work both the peripheral or the central, and I discussed for the ipecac syrup. But for the one we're gonna talk about is the apomorphine. Apomorphine is an opiate, but it's not acting on the opioid receptor, but is acting on the dopamine receptor on the chemoreceptor trigger zone. They act directly to that receptor, and that chemoreceptor trigger zone gonna send a signal to the vomiting center and cause vomiting. For the vomiting action, it can affect both of dogs and cats, but we not prefer to use opioid in cats because we know once you use opioid in cats or horses, going to cause excitement. So that's why we didn't use apomorphine to induce vomiting in cats. We just use for dogs. But for the cat, because the cats, they have the receptor just special for the cat. They have the alpha-2 receptor on the chemoreceptor trigger zone. So we use a cytosine to stimulate this receptor on the chemoreceptor trigger zone. And once they activate this area of the brain, gonna send a signal to the vomiting center and cause of vomiting. So that means the drug that induce the vomiting to use in animal. Dogs, we prefer use the apomorphine. Cats, we prefer use the cytosine. And we're gonna move forward for the anti-emetics. And these groups of the drug we more commonly use in clinic to stop vomiting. And again, for the drug in the on the underlying, that means it's a motor drug. You need to know everything about this. But for the non-underlying drugs, you just know for the unique characteristic for that. We're going to go back to the vomiting center or the chemoreceptor trigger zone. We use the emetic agent by the lipid stimulate for that receptor, right? But for the anti-emesis agent, we're going to block the receptor for that. And the first agent we're going to talk about is the metoclopramide. Metoclopramide, it used to be common drug use, but right now we have the newer one. So the metoclopramide is just less used when you compare for the other one. Metoclopramide is a dopamine antagonist, but it also has the effect on the serotonin receptor. The mode of action is the dose dependent. For the raw dose of metoclopramide, they're gonna inhibit dopamine receptor on the chemoreceptor trigger zone. But for the higher dose, they're gonna inhibit dopamine by itself, that also inhibits serotonin type 3 on the chemoreceptor trigger zone. And also once you use a higher dose, they're gonna cross to the blood-brain barrier. They also inhibit on the vomiting center as well too. And also the solitary tract nucleus. This drug is very effective to stop vomiting. We use a lot, but right now we change the new drug. And the unique characteristic of the metoclopramide is also has the effect of the GI prokinetics. They can increase emptying of the stomach and upper duodenum. So that's why the metoclopramide is commonly used in clinic. Therapeutic indication of metoclopramide is treatment of nausea, vomiting, and esophageal reflux, or any peripheral cause from the gastric ulcer or abdominal gastric motility, because they have the effect on the serotonin receptor as well. And you know from the local irritant is stimulated via the serotonin receptor type. For the metoclopramide, once they inhibit for that receptor, that's why they have the effect on the peripheral causes of the vomiting too. And because this is a dopamine antagonist, and dopamine is not only effect on the chemoreceptor trigger zone or the vomiting center, they have outside from the other side of the brains. So that's why the adverse effect can cause the sedation or the extrapyramidal effect, especially for the cats. So the contraindication of the metoclopramide, you cannot use combined with the monoamine and oxidase inhibitors. For example, this drug is a selectin or the amitase, the one like an anti-ticks agent, can be from the collar form or can be the topical form, or any anti-tick or ectoparasite that can cause the toxicity of the metoclopramide. And for the GI obstruction, it's not only for the metoclopramide. Any drug has the effect of the prokinetics. You cannot use that drug to treatment the GI obstruction at all. Because think about when the GI, they have the effect for the prokinetics, and have the GI obstruction going to be cause the rupture of the GI tract. And the second agent, the one I talk about because we use more commonly than the metoclopramide, because we have the newer one, is the metropytan, or we know as the Serenia. Is a neurokinin 1 receptor antagonist. It's gonna block on the emetic center directly. And as we discussed earlier, the neurokinin receptor is a major receptor on the vomiting center. That's why this drug is very effective to stop vomiting. And is the first drug that FDA approved to use in small animals. That means it includes the dogs and cats. And because the drug can cross through the blood-brain barrier, they block on the vomiting center, and also they block the neurokinin receptor on the chemoreceptor tryptosome 2. This drug is rapid onset of action and non-sedative effect, and has the preparation both together is an injectable and oral forms. The third group of the antagonistic is a serotonin antagonist. The mother drug is ondansetron, or the commercial name is Zofran. It's very specific on the serotonin type 3 antagonist. It's the most potent antiemetic, and this drug is very expensive for the antiemetic drugs. They use in the human medicine for prevent the vomiting caused from the anti-cancer chemotherapy. But small animal they use for the refractory vomiting. That means like once the metoclopramide or other drug is not working for stop vomiting, they use the serotonin antagonist. It's not the first choice because it's a cost-wise, it's very expensive. It's very effective to prevent vomiting associated with chemotherapy. That's why the one I mentioned earlier, because the chemotherapy or anti-cancer drug is not acting as a toxin in the blood. The toxin in the blood, they go to the chemoreceptor tryptosome, right? But the anti-cancer drug, it can cause irritant on the GI tract. And once they irritant on the GI tract, going to produce a lot of the serotonin. And that serotonin is the major substance that cause to stimulate of the local or the peripheral stimulate to the solitary tract or the vomiting center, and that causes vomiting. And that's why once you use the ondansetron to inhibit serotonin, and that's why they're effective to prevent the vomiting from the chemotherapy. Another drug is an antihistamine. This one is just straightforward. It's a histamine type 1 receptor antagonist. The mother drug is a meclizine, or can be like other antihistamine, diphenhydramine or dimenhydramine. They work on both of the vestibular apparatus. This one by the stop histamine signal, or they work on the chemoreceptor tryptosome. For use this one for the antihistamine to stop vomiting is from, you need to know that the vomiting is caused from the inner ear stimulated, or some like motion sickness or the seasickness from that. But the downside of the antihistamine that can cause sedation in the animal. And another group of the anti-emesis is a phenothiazine tranquilizer. It's very effective to stop vomiting, but we not use for the anti-emetic because it can cause the severe adverse effect. And this drug is a chlorpromazine, procomazine, azithromycin. Why they have the broad spectrum? Because they can act three mediators together. First, once you use the low dose, it's gonna inhibit dopamine receptor on the chemoreceptor tryptosome. And they also have the antihistaminic effect on the chemoreceptor tryptosome and on the signal from the inner ear. And once you use a higher dose, the drug can cross to the blood-brain barrier, and they block the signal at the muscarinic receptor. So that's why this agent is very effective to stop vomiting, but we didn't use that because, as we know, the phenothiazine, they can cause a sedation, extrapyramidal sign, or the hypotension, because they can act on the alpha-2 adrenergic receptor, and that can cause a hypotension. That's why we didn't use for the anti-emesis. And the last one is the anticholinergics. These drugs group are atropine, scopolamine, and glycopyrrolate. It blocks on the muscarinic receptor in both central and peripheral. But this drug group cannot cross to the blood-brain barrier. That's why they have only effect to the more to the peripheral region, like on the GI tract. But we didn't use this drug as the anti-emesis because, as we know, the anticholinergic is non-specific action. It can decrease, they can cause areas like a stop movement of the smooth muscle on the GI tract, or the urine retention, or the constipation. And any drug that have the effect to the slowdown of the smooth muscle contraction, we cannot use in case of the enteric infection. Because that means the bacterial or the viral or any pathogen in that cause the infection gonna stay in the GI tract and gonna cause more problem. It can cause a sepsis follow from that. And note that for this drug group, anticholinergic drug, they have the antagonist effect of the metoclopramide. Because metoclopramide, they can cause prokinetic effect, but this drug group has stopped the